There are a lot of people who were recently notified that their Medicare plan is ending in 2025. And if you're one of those people, I'm going to talk a little bit about what you should be doing right now to prepare for this change that will be here in just a couple short months. So my name is Jamie from meetjamie.com. I'm a licensed insurance agent. I help people all over the country understand how the Medicare program works, as well as connect them with the coverage that fits their needs. So we are getting calls as agents from people saying, I got this letter in the mail and it says my plan is ending December 31st of 2024. So here's what you need to know. The Medicare open enrollment, also called the annual enrollment period, runs from October 15th through December 7th. And so all of these companies that provide these Medicare Advantage plans have to have their new plans in place for the coming year by the time October rolls around for the Medicare open enrollment period. So they're working very hard all year long to update the benefits and provide the plans to CMS, which is the Center for Medicare and Medicaid Services, for their approval. Well, one of the things that happens sometimes is they don't even seek approval on some of their plans. They choose to end these plans altogether. And so if you are a person who's on that plan that is ending, now you have some things that you need to do to ensure that you have coverage in the new year. Now, here's the challenge. The average person on Medicare doesn't really want to or even take the time to review their benefits during the open enrollment period. And I get it, because most of us don't wake up in the morning excited to talk to someone about our health insurance. The problem is if you don't do that this year, and especially if your plan is ending and you don't know it, you could be in a much more difficult situation come January. So this is not one of those years that if you are on Medicare, that you're going to want to skip out on reviewing your coverage, making sure it's the right coverage for 2025. So a couple things that you should be focused on this open enrollment if you have a Medicare Advantage. First and foremost, you need to review the annual notice of change. You've probably watched some other agents here on YouTube talk about this. But it is amazing how many people I have talked to in the last week or two. One, they don't remember seeing this letter, or two, they remember it being somewhere, but now they don't know where it is. You need to find that letter. It would have come from the company where your Medicare Advantage plan is. Find the letter, open it up, and see what it has to say to you. Agents don't get these letters. We're not privy to this information. This is something that goes out to you as a member of that insurance company. And so you want to take the time to find that letter, to review what it has to say, and decide, because the coverage for the next year may work just fine for you. But if you open that letter and it says your plan is ending, now you have some pretty big projects in front of you to make sure you have the coverage for the coming year. So there's one of two options here. One is you look at the coverage, you look at it, you say, not much changes. I'm pretty happy with this. My plan isn't ending. You want to make sure that your doctor is in network, your pharmacy is in network, your hospital, your clinic. Find out how your drugs are covered. The second thing is, if you open that letter and you find that your Medicare plan is ending, well, now you have some work that you have to do, because you need to take the time during this open enrollment to choose a new Medicare plan for 2025. Now, there are probably several other Medicare Advantage plans available in your area, so that's the good news. The other thing is, potentially, depending on your situation, if you lost your plan and you didn't want to lose your plan, you potentially now have what's called guaranteed issue rights. This means that you could potentially enroll in a Medicare supplement plan and not be subject to medical underwriting. This is what happens for people when they're first turning 65. You get the Medicare supplement. You don't have to go through the medical underwriting process. You're granted that coverage. Well, if you're in a situation where you now have guaranteed issue rights, then you could actually switch to a Medicare supplement and not be denied coverage because you wouldn't have to go through the medical underwriting. So there's a lot of moving parts to this Medicare open enrollment, this annual enrollment period. It's something that you're going to want to be aware of. The good news is you don't have to do it alone. There are licensed agents. There are people who specialize in this, including even in your state, who can help you navigate this alone. I know it's frustrating. I know that it can be, it can make you anxious, but you don't have to do it alone. There are people who are willing and ready to help you navigate these changes to find the coverage that's right for you. If you don't have someone to help you, I'd be happy to help. You can reach out to me through my website, meetjamie.com, or call me toll free. I'll leave the phone number and the website in the description of this video. If you have questions about Medicare, love to have you ask them in the comments below. And if you enjoy videos like this, please subscribe to the channel. Thanks for watching. Have a great day.